So I grew up in New York. If anyone doesn't know, this is the Rockaway Peninsula overlooking Jamaica Bay. And I am so glad to be back in New York. Here I am. And I spent most of my youth growing up on the jetties with New York City. How many of you know what Rockaway actually is? Rockaway. Anybody? Okay, well, it's New York City's. It only accounts for so much. Part one, quick answers. What is team awareness? What are team awareness outcomes and how is it used by whom? Those are the three main questions people ask. I'm going to go into a lot of depth on all of these as we get moving along, but I want to give you some quick answers right away. So the basic idea here is that employees may be the only influential person in a coworker's life who knows about a problem and can share skills, role model, encourage help seeking, or refer to a resource. So this is something that we learned early on in our research, that employees can be the ear, the confidant, and they know that a coworker has problems at home. They know that a coworker has problems with substance abuse. They know that an employee might have anxiety or depression problems, but they don't have the skills necessarily to help. And they don't think it's their job to help. So what we do is we give them the skills and we destigmatize help seeking. And we also give their group an opportunity for psychological safety and open talk. And we do so while promoting the benefits that employers have or that are in the community if you're a faith-based organization or a coalition, and also skills for understanding how policy works. And as appropriate, we reinforce efforts at social capital, engagement, and resilience. The thing that I've learned over 20 years is that this logic can be extended to any and all health and stress conditions, not just alcohol, which is where it began. So when we see our results, people seek help for any number of problems. It's not just about substance abuse. So that's the first idea. What actually is team awareness? It's all about voice. It's a foundational approach. I don't call it a program. It's an approach that uses an adaptive design, which is informed by the end user voice. And anyone knows who that person is in the lower right-hand corner? You can put it in the chat box right now. Somebody who had voice. We want to know what the employee's voice is, what their needs are, what their aspirations are. And we use that information to foster communication in the work groups, in the teams, in the crews, in the departments, in the communities, in order to reduce risks for mental health and addiction. So that's the basic idea behind team awareness. It's an approach. Now, I don't know if you know, but before COVID, there were like a number of white papers, articles, books coming out describing the crisis of mental health in the workplace. And I've been saying this for years. It makes no sense, and it continues to blow my mind that all the money, not much of the money that we have for prevention, but all of it goes to children, schools, and communities while we ignore parents and adult family members who may have addiction problems that could be proactively addressed by workplaces. If you're not familiar with Jeffrey Pfeffer's book, Dying for a Paycheck, it makes a very clear science-based case for what the problem is in American workplaces with regard to stress, burnout, exhaustion, et cetera, and how workplaces are responsible for that. And then this American Heart Association white paper is really a good one as well. So what we do is we try to recognize that the workplace has the potential through psychological safety to be a powerful healing agent, to focus on the positive, to focus on the strengths-based nature of social connections. And we use this basic idea, one sense of separation, that I'm separate from you and the rest of the world, so my well-being is separate from yours, is the fundamental delusion that needs to be overcome. And team awareness, everything about team awareness breaks that delusion. And it does so in powerful and very, what I would say, vulnerable ways when employees start really sharing. So this is a quick, also, as I said, this first part is a quick overview. And I'm going to show you 4 quick resources that you can access that, because I'm not going to be able to cover everything, so at least you have some tools you can go to. I want you to be aware of the original theory behind this and the research. We had 20 abstracts that we had done research on when I was at Texas Christian University. Before we even built the program, we were looking at what does the data say? So you can go to bit.ly/teamaware-origins and access that slide deck. Secondly, the outcomes. I'll be talking a little bit about them today, but you will see today that what you can get this video as well. Please mute yourself if you're unmuted right now. I'll try and mute everyone if I can. So the next one is what team awareness does and the outcomes. Here you'll see bit.ly teamaware-overview 1. So you can access that. Third, if you haven't already seen this wonderful video from Wendy Cook, who's been delivering elements of team awareness for the past 5 years, it's a great 15, 20-minute video, bit.ly/teamaware-champion. And then this is an important one because we've had 5,000 views. This is on the SAMHSA, Center for Substance Abuse Prevention, Division of Workplace Programs, interviewed me 5 years ago about our prescription drug misuse module. So that's Empowered Health Consciousness, EHC_SAMHSA_2016. If you're interested in the research behind this, you can see my Google Scholar page here, and you can also see my ResearchGate. If you're looking for an article that you cannot find, don't hesitate to reach out to me through our website, which you'll get that information in a moment. So what are the team awareness outcomes? And this is, again, our quick overview before we dive in deep. We have been able to improve the work climate, which means the wellness climate, but also reducing drinking climate or drinking norms. We also improve health and care, coping and resilience, and reduced alcohol risk. But I will tell you, we have a paper under review right now, and I don't know if Sean is listening in. He's my research colleague. But what we have found is that the outcomes are mediated by these improvements in the climate. The vast majority of programs that are out there focus on the individual. And as Einstein said, you cannot fix a problem at the same level that it occurred. Most of the products that are out there for health and wellness are focused on the individual. Most of the prevention programs I have seen are focused on the individual, but we change the climate, the culture of the team. And that's what has a more long-term outcome. So here you have, this is a meta-analysis in progress. Very quickly, you'll see that we improved these 4 different areas: improved climate, for example, reductions in stigma, improvements in coworker trust, improved help in seeking, EAP utilization, encouraging others, responsiveness, coping and resilience, improving areas of different stress. And of course, our reason we keep getting cited is because we also reduce substance use. But I will tell you, for me, even though that's critical and important, it's incidental, because if you don't improve the other things, people will relapse. So we have this over focus, which blows my mind, on just the outcome, but not the conditions, those mediating factors. And that's what we focus on. So you can see some effect sizes here. If you're interested in the research and the citations, you can see that we've been doing this research for a while, and we have both 6 and 12-month outcomes. So who has used team awareness? Again, coalitions, nonprofits, military, faith-based, corporate, Native American tribes, and various industries, and outside of the United States as well. Here are some examples of people who've used various programs of us. I was very excited that we worked with Amtrak last year to help them. We worked with Louisville Metro Public Health, and you'll see different corporations have incorporated our work. We've been very excited to work with the National Wellness Institute. You'll be hearing more about them. Currently, we're working with the SAFE Project, Stop the Addiction Fatality Epidemic, to help with veterans through a Wounded Warrior Project grant as well. So that's the first part, kind of like quick overview. Now, what is the family of programs that team awareness represents? There are a number of people on this call who are only familiar with our resilience program. I'm going to explain where that fits into this. By the way, this is a picture of one of our clients. So it is a family of adapted programs. Why a family? Because it's not an off-the-shelf program. It's an adaptive design. The original team awareness program, and it's been a struggle for us to explain this to people because people think program, program, program. It's an approach, it's a system, it's a methodology, it's a consultation process because we use end users' input, as I said, voice prior to even designing. We pilot and we do iterative development. And we also adapt policies and resources that are available through the workplace or the community, especially mental health resources. And those could be either through the employer, for example, EAP, wellness, or insurance benefits, or in the community. So we always give here's your United Way, 2-on-1, 12-step programs, Catholic Charities. And I have found that very often people don't know about these programs, but as soon as you make them aware, they go, I need help, and we make a referral. So we're really, in a way, referral advocates. It's a mistake to see this as a single program, but to see that there are many extensions and innovations off it, which I'm going to be going through very quickly. It's also not off the shelf. I love this picture. If anybody has had a child recently, and it's not a boy, I'm sorry, it could be a girl. What do I mean? Fidelity is less important than adaptation and capacity building. You cannot just adhere to fidelity and expect to adapt the program. So it's an adaptive design. It had built into its design gathering, garnering, and curating user input. We empower end users from the beginning. And I always go, you can't get employees engaged. Well, you don't engage employees unless you engage them. So you have to ask them, and you listen, and you process consult. We do focus groups, stakeholder interviews, needs assessment surveys, and again, auditing all the human resources that are available. So what happens is team awareness is the only thing that people seem to know about because directories lag behind sometimes the research and the different programs that we have developed. I don't want to bite the hand that feeds us because we're very excited that we've been cited and used by a variety of different directories. However, there's more to it. There's something behind the curtain, Dorothy. So what is an adaptive design? Again, all these studies that I mentioned, looking at policies, looking at resources, looking at stakeholders and focus groups, that's key to everything. And if you take our trainings, we train you on how to do this listening, on how to do this adaptation, and not just be focused on delivering the content, which is the problem, I think, in America. We're so commoditized with our programs that we forget to listen to people. So adaptive design is the origin for everything I'm about to describe to you. So team awareness was originally developed in 94, 98. I was a research scientist at Texas Christian University. We had several clinical trials. It's been replicated, and I've already talked about the outcomes. It has an employee module and a supervisor module. The next program we developed was from a grant from CSAP under a Community Initiated Prevention Intervention grant. We partnered with a local small business development center, a local provider, actually Recovery Resource Council. We did a clinical trial. This was also entered into NREP, and we had similar outcomes. We had a team awareness small business, which is a 4-hour version of the original 8-hour, and also this choices in health promotion program. The next program we developed was also from CSAP under a Youth in Transition to the Workplace grant. We partnered with TGI Fridays, the Council of Hotel and Restaurant Trainers. We also did a clinical trial, and it's also in NREP. And again, we had similar outcomes. The Team of Resilience program, not only did it have a supervisor module and an employee module, we had an ambassador training where the restaurant workers, the young restaurant workers, the 18 to 25-year-olds would nominate peer ambassadors to help sustain the program. And this is where I learned the importance of configuring social architecture so that there's greater chance of diffusion into the social network. And that insight has been one of the most powerful insights we learned, that you just don't deliver the program to people who show up. You think ahead of who else could show up. And you try to create a social network platform to make the program stick in the culture, which is what in fact happened here. So that ambassador training was key. And what happened was in 2002, we published this book with the American Psychological Association. And I had other research colleagues, David Snow from Yale, Max Heinrich from University of Michigan, Royer Cook from ISA Associates, Martin Shane up in Canada, Bill Sonnenstall from Cornell in Ithaca. And what I learned from all of these other research scientists was that what was lacking, and this was 2002, is that providers have no clue what evidence-based programming means. So NIDA gave us a grant, and we developed this software system, and we trained human resource professionals, wellness professionals, and EAP on understanding the importance of utilizing evidence-based workplace prevention programs. We did a clinical trial. We again found increases in self-efficacy among these providers, increased willingness to use evidence-based programs. Actually, some of them actually started contacting some of the developers, and also understanding the importance of culture, again, as a key factor in getting sustainable prevention in workplaces. So what happened was, because I started working with these ambassadors and these champions in HR and wellness and EAP, I started realizing that champions were another critical part of the entire solution. And I've done a number of programs with champion training. You saw I mentioned earlier Aetna and Kaiser Permanente that we do champion training with. So we wrote this book in 2017, Wellbeing Champions, a competency-based framework, because we realized that, again, giving a program without having a champion there to support it, kind of like, you know, you're wasting your money. And I'm saying that because you have to think about the delivery mechanism through which you're providing the agent, if you will. So pause. So all this time between 2002 and 2016, I did multiple team awareness train-the-trainers in the original 8-hour program. I would go on site. I did 4 to 5 days of training. We had a fishbowl experience where employees would come in. We had supervisors come in. It was what I called the whole enchilada. And I did this all over the country. We did this, all the CAPs received this training, all the Centers for Applied Prevention Technologies. We did it in Oregon, Colorado, Texas, North Carolina, Virginia. I was brought to Guam twice, to Cape Town, South Africa, thank God, because they actually did a clinical trial and replicated it. The National Guard in Indiana, which we've seen great uptake, and in New Hampshire. I'll also want to do a shout out to the state of Nevada. They didn't receive this because I learned some lessons, which I'm going to talk about here in a moment, and other states as well. Tennessee was here. So what we found from doing all this work, I mean, it was a lot of people. These trainings usually have between 12 and 20 people going through a train-the-trainer. We found out that the need was strong, and people got a lot out of it, a lot of satisfaction. And when you listen to Wendy Cook, you'll see how she, as of Indiana, was able to continue to use it as one example. But what we also found, for the most part, was moderate dissemination. Employers have stigma still, even now, still stigma around using substance abuse and mental health prevention. We found that coalitions lack the capacity to deliver the full 8 hours and do all of the upfront consulting. It's fairly intensive work. We found that employers have, we already have an EAP. We already have a wellness program. And there was some, what I would call territorial or political issues. Who are you to come in and offer something to us for free that we're already paying for as a benefit, which blew my mind. We found also that with prevention providers, the funding streams, workplace is not a priority. It's never been a priority. It's been schools and children and communities. We also, at the same time that this was happening, we saw this incredible increase in the use of cell phone and smartphone apps and increased commoditization of health promotion. So we moved away from this culture-based thing and more to individual people on their phones getting whatever they need here, which completely was against this whole idea of bringing people together, creating that psychological safety, creating intimacy. So there was lots of reasons that this did not work as much as we wanted to. I still believe in the whole enchilada, and I hope that people on this call will use the whole enchilada, but, and which is what I'm going to talk about next. What did we learn? we learned that of all the modules in the original team awareness program, that the module number 4, coping and resilience, the stress and coping model, was the most likely to be used. And it was, in fact, the most individual, not the most group. So people had a greater appetite for this. So we really focused on resilience and thriving. And I decided to write this book in 2014 called Raw Coping Power, and put a lot of the tools that we've been using, very cognitive behavioral, very evidence-informed, if not evidence-based. And we developed this resilience and thriving program. Since 2008, we've trained close to 300 facilitators, many of whom, and some of them are actually on this call right now who can share who they are. Please shout out, just put your chat. Hi, I'm one of those facilitators. I'm talking to you, Dan. I'm talking to you, Cynthia. I'm talking to you, Lori. I'm talking to you, Laura. Who else is there? That have been delivering this program, this single module. And what we've done over 1,000 pre-post session ratings. It's not been itself subject to a clinical trial, but it's an integral part. And we have found through all of these self-report ratings, increased awareness of the role of stress and substance use, increased willingness to use healthy alternatives, increased knowledge of signs of unhealthy coping, and increased self-efficacy in using healthy coping instead of pornography, alcohol, TV, whatever it is that people have that they're using to take the edge off. So at the same time, we were approached by SAMHSA through the Prescription Abuse in the Workplace Initiative, which you aren't aware of. It's a great set of tools that they developed. And they said, based on all the great work that you've been doing, why don't you build an adaptation for prescription drug misuse? So we created Empowered Health Consciousness. It's a module that, like the coping and resilience module, they can be delivered in an hour to 3 hours. And we made it, again, easy uptake. And so we've done several studies with this. You can see a number of these here, and you can see some of the outcomes. This is from our 2018 paper in the Journal of Applied Biobehavioral Research, where one of our key outcomes is staying conscious of my own health can protect me from misusing prescription drugs. And there you can see some other things here. I know things that parents can do to prevent their teenagers from abuse of prescription drugs, which is that was our most significant finding, because we spend a lot of time on reaching parents to help them with understanding prescription drug misuse. The other thing that happened was that the supervisor modules in both team awareness and team resilience really led us to understand the importance of management, not just the champions, but the managers. So we had actually written a book called Heart-Centered Leadership with my colleague, Susan Steinbrecher. And we incorporated that into the TGIF study. I actually used that with the managers from about 14 different restaurants. And it was very effective. And so we approached the National Heart, Lung, and Blood Institute because we found that managers were subject to their own cardiovascular risks due to mental health, due to stress, due to hostility. And we did a clinical trial, and we found there reductions in manager stress, manager hostility, and improvements in lifestyle, and also improvement in transformational leadership as rated by themselves and their employees. And now we're actually doing a new program if you're interested in aligning leader strengths. So that was another offshoot. The last offshoots that I'm going to talk about is that through all of these programs, what's implied is referral. That is referral to treatment, referral to the EAP, referral to a counselor. In the work that we did with the National Guard, we saw a significant increase in self-referrals. And so, as you all know about SBIRT, screening, brief intervention, and referral to treatment, we thought, can we technologize SBIRT given our ability to do software development? So we approached NIAAA, and they gave us a grant, and we did that. We created this program called iLinkWell. We did a clinical trial, and it's actually an online system for ESPERT. And that is another piece that comes an offshoot of all of this work. Again, we found reductions in alcohol use, prescription misuse, and also stress. Finally, the last one that we did was because the team resilience training is so long, we also kind of collapsed that into an online module. We did a couple of pilot studies, and we found some improvements in resilience through that as well. So that's the entire family. I know a lot of you are interested in team awareness per se, but the message I'm going to send to you is find out what you need and let us help you get the right set of tools. And that may be the whole enchilada, but it could be some guacamole, it could be some salsa. You know, sometimes I just like chips and guac. So if you want a whole enchilada, be careful, because as I showed you, hard to deliver. So instead, try to think about taking it in small chunks. So it all begins with listening and finding evidence-based tools to fit the voice, the need, and the aspiration of the different providers. And I will say that mental health providers themselves are part of an employee base. So we need to take better care of ourselves. And that's why we always recommend that the first thing you should do is utilize these programs within your own agencies before you even think about delivering it to others, because that's where the impact is going to be maximal. That's where you're going to have more optimal uptake. And as we've seen, mental health stigma among the provider community is as high, if not higher, than the general population. And mental health providers, counselors, social workers, clinicians are burnt out and exhausted. So we need to do things to help our own. So our consulting work, this is a paper that we wrote where we realized that the idea of manager and leadership development, team training, well-being champions, climate assessment, EAP, wellness linking, really required this consultation process of discovering what's needed, adapting the program, implementing and evaluating it. And this is, I describe all of this in this 2018 paper, if you're interested in learning the details. But here's the basic idea. First, we assess what's the current state. This is the consultation that we do and we help you to do. What are the needs, what's the readiness, and what's the culture? Then we design based on the assessment employee voice and take our proven content. And then we deliver with great sensitivity to the scheduling, the sustainability, the resources, and strategy. And then finally, we evaluate. So this process is evidence-based. The process is evidence-based and is as important as the content. So now let's drive down into the content. What actually is the full enchilada team awareness program? Okay, here we go. Team awareness. The purpose we always say at the beginning of the team awareness training is to improve communication in order to increase strengths and reduce risks, while enhancing the well-being of oneself and others. That's the synoptic summary purpose of the entire team awareness program. Our core maxim, and I'm restating this from our first slide, you never know when a kind word or pausing to listen may have an important positive ripple effect for others and the community. And this is not only a maxim, I've seen this time and time again to be very true, that we need to tap into more. And I believe it's the foundation of ethical health, it's the foundation of the golden rule, it's the foundation of the Hippocratic Oath. The core motto of team awareness is usually the problems we face as a group are not the fault of any one person. More often, we are all responsible for the solution. As you all know, there's lots of, in our political climate, there's a lot of finger pointing and blaming. And it's because there's a lack of psychological safety and because there's a lack of collective responsibility. So this training actually improves this sense of organizational citizenship. I don't have data to share that, but I can tell you that it's a key part of this work. So what are the core modules? There are 6 core modules: relevance, why are you here? Policy and benefits, how your work matters. Your level, which is what is your current level of coping. Your tolerance, how can you best respond rather than tolerate problems. Communication, how can you listen? And compassion, how to encourage. So I'm going to do a very quick chat here that I'd like you to, when you look at these 6 modules in the chat box, what I'd love you to tell me is, which of these do you think is the most important module? Just off the top, think if you were going to go ahead and deliver one thing, what would you deliver? And I'll take a minute for you to type that in. Is it making it relevant? Is it going over policy and benefits? Is it going over your current level of coping? Is it responding? Is it communication? Or is it compassion? Go ahead and just type it in. There's no right or wrong answer. And then the reason I do this is to kind of set you up for what we're going to be doing. And it also helps you to understand that team awareness is modular. You can deliver every one of these modules by themselves, except the compassion module, except the final module. And you'll see that in a moment why that's clear. Hey, Matt, relevance. Okay, so some of you are saying communication, but you're delivering the stress module. What's up with that? Okay, here we go. Thanks, guys. You're doing great responding here. So relevance, what is the relevance module? We use exercises for the complete purpose of engaging people, inviting conversation and listening. The relevance module uses group level motivational interviewing, forms of appreciative inquiry, empathic awareness, and lots of flip charting. I'm going to show you samples for each module. Here are 2 samples for the relevance module. The first sample is this list of our 7 principles that are wedded within and embedded within the entire program. And what we do is we have someone stand up and they draw a picture based on the rest of everyone's input. And we can do this online now too by using whiteboarding. So what it is people draw a picture, of what a willingness to expand looks like. Draw a picture of resilience, draw a picture of communication. So it's a very engaging group activity. So that's one of the relevance activities that takes about 15 minutes. We also help them assess the risks and strengths in their work climate using this health and productivity climate measure. So what we do is we collect this data anonymously and we give that back to them, always using what we have as our chat guidelines, which is confidentiality, honor, anonymity, and teamwork. So we give them direct feedback about, anonymously, what are the overall risks and strengths in your work climate? So that's the relevance module. The policy module, module 2, is really about team ownership of policy. The one thing we learned early on is that people don't look at their policy and their benefits after the first day of being hired under their onboarding. And I know there are people here who are very strong in benefits delivery, and it's sad that employees are not only not aware of it, but what happens in this training is people start using it. So what we do is we engage them around responsibility. We engage them around that ethics. And we ask them to realize, hey, your human resources are here to help you. Your short-term disability benefits are here to help you. Your insurance is here to help you. Your EAP is here to help you. And we repeat that throughout the training. And we do it through quizzes and games in a fun way. So that's the second module. And you can see here the whole idea of no matter what the problem is, you can get help for it. And you can, even if you slip or get caught, you can still get help. And it's important to understand at what level, and this starts to go into our coping resilience module, you're functioning at. And it's not, again, like I said, just about drinking. The third module, which is the one that I've said 300 people have been trained in, are currently called Resilience and Thriving, uses cognitive behavioral tools for internal coping resources and methods for moving up one's level of well-being. Uses self-assessments, group discussion, flip charting. We have a long discussion about the role of culture and stress. This is a discussion. And by now, if you're using the full program, people are very willing to share their opinions. This is a model that we adapted from our work adapting this program with the National Wellness Institute. And we talk about coping, resilience, and thriving across the 6 different areas of well-being. We also provide continual adaptation of handouts. So we created this handout. If you email me, I'm happy to share this with you. This is a Resilience and Thriving resource sheet for COVID-19 stress. Lots of great tools here. So we always provide resources. The fourth module, actually, I don't know who said it, this is my favorite module. I feel it is the most important module. So whoever it is at Leaf Inc., who are you? I would love to talk to you, because the Tolerate or Respond module is really where, I don't know if you can deliver it by yourself. I think you can, but it's so much more powerful if you've delivered it with the previous 3. We do small group exercises that encourage personal and group reflection on stereotypes and ways groups and social norms enable or address those stereotypes. And we talk a lot about multicultural resilience, the importance of recognizing that one's background, ethnicity, heritage, ancestry is very important to how we respond and how we are resilient. So the key example slide here is this idea of moving, again, up levels. Instead of stigmatizing and tolerating, how can you respond and show compassion? And we do exercises, actual compassion exercises in this module. The 5th module builds on all the others. It uses one-on-one paired exercises. And you can see here how all the previous modules do that, because what we're doing here is building communication in order to reduce risks and build strengths. We're talking about the idea of importance of social support when and social connection for managing stress. We talk about the 5 C's. We also incorporate that into stress and resilience. That's a adaptation. And as you just saw, the Tolerate and Respond module. The final module, which is what I call the capstone module, and the one that I never suggest you use by itself, is the Nudge module, which is using small group role plays. Basically, Nudge is notice someone with problems, which builds upon Module 1 and Module 3. Understand your role, which builds upon Module 1 and Module 5. Decide the best course of action. Use the guidelines that we've given you, and then encourage with compassion. So in many ways, this is a peer referral training. And what we're doing is we're gradually improving coworker, collegial peer awareness and their courage to share with another person their concern about the problems that person is facing. So that's Nudge. We've had this translated into Spanish, and we've had others translated into Spanish as well. So it's done through role plays, and that's a synopsis of the 6th module. So our 4th poll that I'm going to give you, even though you haven't seen everything, I just like to do this to kind of get us engaged. This is the 4th poll, and it asks you, of the different programs and consultations discussed, which of the following interests you? So the original team awareness, just the resilience and thriving, the empowered health consciousness, prescription drug misuse, the team resilience program, and or the consultation. And it can check all that apply. And the reason I'm doing this, I'll reveal in a moment. It's kind of like my secret, like, why am I doing this? Okay, a couple more. We need a little more. Leave it open. Leaving it open. I only got 60%. I'm looking for 75% of people voting. We've got almost 50 people on the call right now, so trying to get more of you. What all that apply? Okay, I'm going to just show the screen. So what's interesting here, as you can see the results, the team resilience program, right? And the resilience and thriving, which is interesting because you all, I think, are here because you're shown that team awareness is a promising practice in the OASIS, but now you can see that it takes a little bit work to get there, which is great. Any questions or comments about that, please let me know. Okay. So next slide. Final part here, options for use. Can you all see the slide? It says part 4, options for use. Can someone just say, yes, I see it? And that way I know I'm good.
Yep, it's there.
You can?
Yep.
Right. Okay, so options for use. Team awareness options. I'm not going to show you the pricing list. If you're interested in the pricing list, you can email me. I'm putting my email in here, learn@organizationalwellness.com. And the reason for that is that, as you can tell, we need to understand what the needs are. So before I show you pricing, I'd like to talk to you. But we definitely do discounts for multi-agency collaboration. The most important thing I will say up front is consider walking the talk. We strongly recommend you and your staff experience any of our trainings first and prior to receiving Train the Trainer. By using the tools internally with your own coworkers, your staff, your coalitions, etc., you learn firsthand and walk the talk of a culture of wellness. And we have people, I think, on the call from Prevention Insights in Indiana who've actually done this. So this is the first and most important thing that I stress. One of your options is just to get the materials. So we do have the updated 2018 6-module slide deck that you can download from our website. You can also download the original 2011 Team Resilience materials. That requires contacting us. You can also access the Resilience and Thriving module, the Empowered Health Consciousness module, and copies of Raw Coping Power. We highly recommend that because it has everything that you need in one book to kind of summarize this, and we do provide discounts for that. Again, price sheet available upon request. Regarding training, you have a lot of options. You can get the Resilience and Thriving training, which includes workbooks, slides, rating forms. It's delivered in 2 sessions across 6 hours via Zoom, and you have some preparatory videos. You can do the same thing for Empowered Health Consciousness. Now, you can also receive through online the 8-hour program, but you first have to go through the Resilience and Thriving training. Because as you saw, it's like get the guacamole before you have the enchilada. I don't know a better, now I've been in Texas for 20 years. I don't know what the New York analogy would be. Have a chestnut before the bagel? I don't know. Okay. Online training, 10 sessions. It's actually 10 separate sessions. Cream cheese before the bagel. Thank you, Kim. Vegan cream cheese with honey nut cream cheese. So you'll just see how this works. You get the relevance module, the policy, tolerance, communication, and nudge, but you don't need the resilience one because you already have that one. And then there's also the Team Awareness Supervisor module, which is an additional 2.5 hours training, but that also, there's a prerequisite for that. Other considerations, key consideration here is that you can have on-site. With COVID, this has proved more challenging, but we can also set up a hybrid where some people are on site, we have video set up, and other people are watching while we're doing it on site. So that's a possibility. And also consultation on a lot of other things, that, consultation on adaptation, evaluation, logic model, fidelity, and using our integral process consultation model, which was described in that 2018 paper that I showed. So again, you have some quick things you can look at based on what I shared at the very beginning if you wanted to quickly follow up. Of all these, I really think watching Wendy's video, bit.ly/teamaware-champion is a great way to see how people have done this, who have gone the whole team awareness program. And of course, our research. So that's us. Any questions I have, I can open it up for questions. Just raise your hand or put them in the chat box. Lori says, as a trained facilitator in both resilience and thriving and empowered health consciousness, I apply many aspects of this content on a regular basis with my team. Lori, do you want to share? I'd love it if you wouldn't mind sharing a little bit. Sharing the screen. Lori, where are you? Open your voice.
Yes, can you hear me?
Yes.
Great. Yeah, being trained in both empowered health consciousness and resilience and thriving, they complement each other well. And, I just find the concepts, the tools, the credibility, the receptivity, the individuals crave this and teams crave this. And, when they see it works and they try it, it's just a nice set of tools to have. It's, I know that they are supported by the evidence and the research, and I'm just thrilled that I delved into them. And I see I tried it across different populations, working in self-care, working with colleagues of mine, also really kind of applying it to tobacco dependence. And that was another world that I had no idea there'd be such receptivity to. So right now I'm working with individuals, other coaches who provide services to individuals with mental health issues. And again, it's just, it's welcomed, it's comprehensible, it's usable. And, so I definitely think that these programs are the ones that I'm familiar with. And I've, since September, I've had a great deal of success using.
Thank you, Lori. From the Buffalo area.
Yeah. Go Buffalo. Let's go Buffalo. Sorry.
Great. Any other questions or comments? We've got some great people here. I'm glad to see you, Dan. It's been a long time. You're still on the beach.
Hey, Joel. Yes, I live on the beach in my apartment. So I'm only trained in the resilience and thriving module, but I've had a lot of success. I get a significant number of requests for it. All the feedback has been extremely positive. I love it because it's evidence-based and has peer-reviewed research to support it. But every time I deliver it, people come to me afterwards and say they're using it and find it beneficial. So, I want to learn more and deliver some other modules. It's just finding time in my busy schedule right now. This is all of this stuff is so important, particularly right now with all the crises we're swimming in.
Stephanie, yes. Hi, Laura. Any other questions? This is I'm calling. People are here, but anyone else have a question that wants this? Oh, who's from Leap? I saw a Leap. Leap, who are you? You know so much.
Hi, me, Julie. We talked on the phone. Julie Dawson.
Yes, I'm glad you now you got it right. It's all about tolerating versus responding versus tolerating.
Did you see my question about recovery-friendly employment?
Okay, yes. So perfect. So this entire set of programs, together and apart, are very important add-on supplement to recovery-friendly workplace initiatives. We've had the Recovery-Friendly Workplace Initiative out of New Hampshire, take the training, and we've done some, have had conversations with people who are involved in second chance hiring. This program is so powerful because not only does it destigmatize addiction, it helps those people who are in recovery to share their story. So instead of looking at recovery as something that employers should do, right? Recovery support, we do it from the inside out by empowering the employees who are there, and they are there. Every workplace has people in recovery, and they don't talk because of the stigma and the shame. This program, every time we do it, there's someone in recovery in the room, bam, and it's powerful. They share their story, people come up to them, the psychological safety, and it blows my mind that stigma still exists when you have such strength, hope, and wellness, right? The whole wellness field hasn't got a clue about wellness when they haven't talked to somebody in long-term recovery. I'll just say that, right? It's crazy. So, did I answer your question, Julie? Do you want to say something about your work, Julie?
Oh, no. I just when we are looking at adding this to our work plan, we just want to connect it with our recovery partners.
They do this if they're playing.
Yeah. Other questions or comments?
Can you hear me?
Yes, hi, Cheryl.
Hi, how are you? I'm a recovery coach trainer, so I'm aware of the recovery community in that way. And also our agency has a recovery center in our space. I could easily see what you're doing, working with that population, particularly with peers and people in recovery in the workplace. I think
it's a force multiplier, right?
Yeah.
And not only that, because I know Dan works with disability, it's also people who have any kind of disability who are re-entering the workplace. Because it doesn't only extend to, like I showed you in the role plays, it could be diabetes, it could be coming out of a long-term illness, it could be people coming back to work after COVID, right? So it has that, it's a right, universal, selected, and indicated, right?
It's true.
Stephanie or Laura, do you want to share your infinite? Oh, Matt, you have a question.
Yeah, Joel, I know you've talked an awful lot about this not being a program, and all of us, I think, are so conditioned to thinking that way that it might be a struggle for other people than just me. We all have OASAS work plans, of course, that are due that we got to put in there. If we were to say devote like half a person to this over the course of a year, can you give me some kind of an idea about the amount that we think we could promise to do and what some of the outcomes could possibly look like?
Yeah, definitely. So great, Matt. Perfect question. And I'm happy. I know we're after the time here, but I'll stay on and this is recorded. So additional questions as you're watching the recording of this, please send them to us because Matt's questions is a perfect type of question that I was hoping to answer. It all begins with your target population, Matt. You have to think about who in the community that that could be potential recipients of the program, and finding your early adopters, and then approaching them and say, can we do focus groups? Can we do interviews, right? So if you're going to deliver the program in its quote original adapted version, right, as an approach, that half-time person would spend, I don't know, a month to 6 months pounding the pavement and doing discovery, right? Doing focus groups, listening, showing them that people don't care how much you know until they know how much you care, right? So you've got to find somebody who's really good at that. And within those focus groups, you can deliver a module, but deliver it as though it's a focus group. Hey, what do you think of this program? And get feedback. So instead of looking at, we're going to give you this program, you say, we're thinking about giving you a program. We'd like your feedback. So you train your half-time person on consultation, on delivery of a module, on focus groups, on interviews, right? And get them up to speed so that they become very agile in being able to speak to the interests of the employer, right? And when you watch Wendy Cook's video, you'll see that she actually did some of that by talking to managers first, right? So capacity building, capacity building, capacity building. And using the process consultation skills, which we can train you in, and picking a module, whether it's a resilience module, the communication module, empowered health consciousness, right? So that you have that. That's what I would suggest. And then as you gain entry, start thinking about the up level work, right? And meet them where they're at. Does that answer your question, Matt?
It does to a degree. I mean, we're obviously going to have to talk more, and I don't want this to be,
No, it's great.
But I mean, I do know, I'm assuming that what you just described, that's part of what you're offering in terms of getting that person to that level.
Oh
The
yeah,
training- the training speaks to that helps with that. Okay.
Yeah, the consultation part of our training, and we would do it whatever, we would do it as a supplement to any module you would select. So we would do both the training of the module, and then we'd have some time to talk about consultation and facilitation.
Great, thank you.
Yeah, great question. Other questions? Hi, Doug. Doug is there.
Hey there.
Where are you from, Doug?
I'm the one in the North Country of New York State.
Finally.
I have a comment. This is for my New York colleagues. I know Matt's one of those and a bunch of others, Julie, that New York has a law about mental health education in the schools, and in the reopening guidance that the state ed department has promulgated about a month ago and schools are responding to, there's about 11 pages out of 145 are addressing social emotional learning and wellness. And thankfully, the first part of that is addressing wellness of the staff, which is the first time I think I've ever seen such a thing. And certainly looking at organizations like CASEL or CASEL.org, that the Committee for Academic and Social Emotional Learning, they've got some great resources. So it's seeming to me that there is a foundation here in New York State for us to do some huge work with the schools. So we are in a small, a big county with small schools from 70 kids K-12 to maybe 800 kids K-12. And most of our small schools do not have the depth of support staff to be able to do much of anything in the area of social emotional learning. And so they look to a prevention program like us and say, well, here, you guys do this. Well, okay, but there's no framework for that. And so this seems like a really helpful thing for us to use. And I know I have colleagues like Julie and others who have connected with you that I think we ought to connect with and do some broad-based planning.
Yeah. Oh, it's music to my ears, Doug. I have to tell you a quick story. I've been delivering the talk about this program for years at CADCA, conferences. Every time I deliver this training, I mean the overview of what it is we do and talk about adaptations, everybody leaves and at least one or two people in the back of the room, and they go, you need to come to our agency. We have problems. We need your help. And they do it just like that. And then we try to do work with them, but there's this incredible barrier, right? Because there's this, in the profession, I will say, there's self-stigma within the profession. And it's the problem. That is the problem. right?
One of the benefits, I think, for the prevention field, well, in treatment, is that the nature of what we do is that we are all fallible and fallen and need some support of some sort. And if you're in recovery, that's real clear. And I think some of this helps us expand the idea of recovery. Sometimes I call myself a recovering human being, and that seems to work with people, you know.
Finally, I met
myself.
somebody. Doug, where are you? I need to come and talk to you. I finally met somebody else.
I'm about 200 miles from Julie.
Any other questions? Because I know Stephanie and Laura are here and they've done a lot of work. So I'll let them speak maybe. You want to share, either one of you, about any of this?
Sure, I'll share real quick. Sorry, I've been waiting for my granddaughter to stop screaming in the other room. I am I've been trained in the resiliency and thriving, and I am the health promotion manager at Anthem for the state of Georgia. And so in the past year, I've had a unique pleasure of working with Joel on my thesis as well. And my whole thesis was around resiliency in the workplace. So I provided this training to several different cohorts and saw some incredible results through the tracking evaluations pre-test and post-test. And granted, they were early results, but it was, you were able to show that through the training that people were better able to recognize when they weren't dealing well and when they weren't using healthy coping methods. And I think also more importantly to what I heard a few people say, because I had joined late because I had another presentation, they were learning to, one, ask for help, and most importantly, learning where to find those resources to ask for help and what those resources were. Because that's a big part of the program, is learning what all the resources are. And so as part of when I do the presentation, I incorporate not only, the resources that Joel showed you, but being part of the insurance carrier, I tie it back to what they have as part of their insurance design. And then if they don't have the insurance, then I always have what I call for fun and for free resources for those employees that don't have the resources. But I've seen a lot of good work come from this, several employer groups. As Joel said, there's a lot of things that can come out of it. One group that I've worked specifically with, I just finished another 4-week series with them. We did the resiliency training again. And then from there, we built out 3 other sessions. I also did the resiliency coaching class with Joel. And we took some of those resources and did another whole session just on coping skills, using some of those resources from that individual coping class, and then dove into a few other things around mindfulness and then lifestyle choices, because all of that rolls up into resiliency and thriving. And I think one of probably, and I've done a lot of it, it seems like in the last 4 months with this pandemic, that is all I have been doing is mental and emotional help. So this has really been a great resource and tool. Every employer group that I work with, when I say, this is what I have, they're like, we want it. How soon can you do it? And it's one comment from an HR person who came to my Wellbeing Wednesday when I did it for the HR professionals. She said, because I offered it back in March before this whole pandemic started and we sheltered in place. And then she took it again in May. And she said, I took it in March and I took it again in May. She said, but what I did not realize is how well I was not doing until I took the pre-test and the post-test again. I mean, it really sunk in. I thought I was doing well, but when I had to answer these questions again, it made me realize I'm really not doing well, and I really need to implement some things so that I can take care of myself, so that I can take care of my employees.
Wow, Stephanie, I so appreciate the work that you're doing with this. I know you've talked a lot, but I have to ask because there are people, you've also done some capacity building and prep work. You want to quickly describe the work that you do there too, using some of the consulting work too?
Are you referring to the prep work with Dullier with the organizational?
Yeah.
So one of the things that I got to do as the prep work for Dullier, the organization I've done a lot of work with, is in the raw coping power. There are several exercises in the back, and one is an organizational audit. There's actually two: the stress audit, which lets you know where they are and how well they're doing, and the organizational, help me out, Joel, what's it called? Resilience. And so it gave me a really great foundation to come in to do the training for them. So I met with their management in 2 small groups and did these 2 assessments. Thank you. I haven't had lunch and my synapses are not connecting well. So I did these 2 assessments to have a level set before I went in. The reason why I was called is they had gone through a lot of change in a very short period of time, and they knew they weren't doing well, but I needed to know how not well they were doing, if that's proper English. And so these 2 assessments gave me ideas of what I could pull from with their strengths and, you know, how bad they were doing, so I could help them figure out a game plan and give them some black and white for their senior leadership that says, okay, this is where you are, and if things don't change, this is where you're gonna, you know, come into some pretty major problems. So they were 2 very, very effective skills. And it also showed that their employees were ripe for health promotion. They were almost begging for it. So, and then pandemic hit. So we're doing what we can in the virtual world now.
I appreciate your sharing. So Matt, and thanks so much, Stephanie, because Matt, when we talk about preparatory capacity building, we actually have concrete tools for that as well. Good. And what's really important here, going back to, I mentioned Jeffrey Pfeffer's book, Dying for a Paycheck, the stress that people are under is coming from the workplace. So what happens is you start waking them up to the fact that maybe some of the stressors that employees are under are your responsibility, right? And so that's what Stephanie's been able to do so successfully, and that's something we also provide training around.
That assessment that you talk about doing, Stephanie, has it been redone after your sorry, user program, sorry, but after a time has elapsed of implementation to then show movement quantifiably?
It has not been done yet. We started sheltering in place, and so everybody is in the virtual world, so it's a little bit harder to do. It was we did it in person, so and it's something that I need to talk with the HR staff about, if they're willing to redo it, and if I just give it to them if they'll redo it. They've also had a little bit of leadership changeover, so I'm not sure, you know, if we'll be comparing apples and apples, but it is something that we can look at doing again.
Thank you.
Mm-hmm.
Other questions? You can also put your questions in the chat box. Are there any that have come through? I don't see any. So any other questions for people from New York, especially since we want to make sure you get your cream cheese on your bagel?
Hey, it's Kim. I mean, our work plan is due on Tuesday of next week. So, you know, we're plugging in programs, you know, right now. So I was just open to any of my New York pals who want to chat maybe right after this or at some point, how you're thinking of building it into the work plan. I'd love to kind of chat about that.
Yeah, Kim, let me say, I'm happy to get on a call if you want to all get together. You know, I think in other states, we've done collaborative projects, right? Which helps kind of defray cost, if you will. So sort of kind of in the vein of team awareness. Ha ha, that was funny. So if you want to do that, let me know, right? Just send me an email. I'm here. Cameron's listening in, and Shelby from staff, and other people who, Cynthia's here. You want to say hi, Cynthia? I don't know if you can. Yeah.
Hi, everyone.
Speaking of New York, Kim, do you have any follow-up or specific questions to that?
No, only that you won't be surprised that Brandy and Sarah from the Safe Potter, Sarah Potter from the Safe Project are two of my my buds. We do a lot of work together. So they already spoke your praises, and they're excited about working with you on the other programs.
Okay, well, I know if you have something due Tuesday, you know, I'm willing to work over the weekend.
Yeah, awesome. I think definitely I'm gonna, you know, see what I can plug in. And if you have time today, I'd love to chat with you one-on-one.
Email me.
Perfect.
Okay. Laura, do you want to share a little bit before we jump off? Because Laura's done also a lot
Sure.
of, and I'd like to have you benefit from her knowledge too.
Okay. Hello, everyone. I'm the Health Promotion Manager at Tinker Air Force Base in Oklahoma. So the employees that I work with are military, active duty airmen. And a few things that I did to adapt the program, Resilience and Thriving, I call it From Stress to Thriving. And the resource guide, so when you go through the training, Joel does give us different resources, and I actually added those along with the 6 Dimensions of Wellness from the National Wellness Institute. And I created a booklet that has all the resources for on the installation with our helping agencies and also off the installation. So in the community, I give that to everyone who goes through our class. I also have it on all the computers. So there's over 25,000 employees at Tinker Air Force Base, and every single one of them has access to this resource guide. And I really do encourage that because it has an opportunity for them to get help, and it includes the class as well. So if they wanted more information or wanted to have the class in their area, they could, or if they just wanted those resources to help. I am going to add the COVID ones now as well, but I do have that as one of the things that I've done along with teaching the classes. And I had it was pretty easy for me to get into the different squadrons because I had already worked with leadership, and building relationships makes it so, I mean, it's a lot of work, but it makes it so easy to actually implement this program in multiple aspects. I also am going, there's a big leadership change because they change every 2 years. I am going to be in their next big conference. There's going to be over 1,000 leaders. I am so excited. I just found out about this yesterday afternoon, and I'm going to be able to take some key elements from Resilience and Thriving and brief it as the very first briefer for this week-long conference, and then being able to implement that in their squadron or in their flight level. So I'm really excited to be able to incorporate that into, along with just reaching out to everyone who wants to teach it or wants me to teach it. So.
Yeah, again, I'm so honored, Laura, and I know I'm glad you talked because I want to go back and give Matt a hard time since he was giving me a hard time. So Matt, can you hear strategy here? Is there strategy here? Mm-hmm. That's what I'm talking about.
Yeah.
It's really, and Laura did a great job because she saw that the promotion of the how to get help was something that was lacking. And what she did is she kind of reverse engineered it. And on the how to get help information that went out all everywhere, it had sign up for resilience. Mm-hmm. You see? So what you're doing is she thinks strategically, and Stephanie as well, that's a key part of this, that if you're sitting there waiting for people to come, it ain't gonna happen.
No. The other thing you had mentioned, Joel, as well, and I was able to participate in the Aligning Leader Strengths. I loved that workshop. I definitely encourage everyone who's thinking about doing any other training to go through that, because you do find out what your strengths are, and my number one is strategic. So being able to know what that is and how you are as a leader, or how you're going to be leading change in your organization by incorporating in some of these different trainings can help. Plus it helps because there is that resilience piece. So if you're looking at it for yourself, it's so much easier to then be able to incorporate that into your organization as well.
I did not pay Laura. I did not pay Laura to say that.
No, but it was amazing.
Well,
I definitely recommend it.
I should mention that I'm doing that with Dr. Ben Dilla through the University of Dallas. And so that's going to be coming up in October again. So if you want to be involved in that. But I do agree that whole idea of champions that I talked about and leadership, that's a key part of this. And if you are approaching an employer, a manager, it could be somebody on your board. If you're working in a coalition who works in the area, it could be the school administrator. When you can talk to them at the leadership level and talk about your own strengths and resilience, you have, again, strategically, a greater chance of getting them to see the importance of this. But if you come in with, hey, I've got a substance abuse prevention, as we say in New York, forget about it. Just forget about it, right? But if you come in from a different angle, like the one we just talked about, that's what I mean by approach, Matt.
Fair enough.
All right. Well, I know we set 90 minutes, and I really appreciate all the great comments here. Again, if you're watching this and you want more information, please email me. The information will be below. We're going to put this up on YouTube. I hope that I do get to work with you, and I do hope that either way, that the message here is take care of yourself, right? And find support in each other. I love New York. I miss New York. I want to go back to New York. It does not, the beach that is behind Dan is not Rockaway. That's not what Rockaway looks like. But it's better. Rockaway's better than that, man. Rockaway!
Come to Lake George, salt-free and no sharks.
The Hamptons. If he's going anywhere, he's going to the Hamptons.
I have a
All right,
pool.
everybody. Take care.
Thank you, Joel.
Thank you so much. Thanks, Dan. Thanks, Laura. Thanks, Stephanie. Thanks, Cynthia. Thank you all.